Hello and welcome. I am Dr. Jamie Kunkle, and I'm joined here again with Dr. Janell Payne. And we are, drum roll, confronting the complex. Yeah, I guess that's what we're calling ourselves now. And what does that really mean? I just wanted to say a few words about it before we begin. Confrontation, traditionally, is considered to be very negative, very, you know, you're confronting me and you're fighting me, you're attacking me, I'm offended, all this kind of thing. And that's not really the purpose of confrontation in our view. Our view is to confront or to, in this case, actually discuss and talk about all the intricacies and the complexities of our patient population. But this isn't just about you guys either. The complexity about living on this earth as a human being, honestly, too, just because there's so much to consider and to think about. The complexity of scientific paradigms, the complexity of nature, the complexity of complexity. I don't know, complexity of human language. Uh, there's so many things to say. So I just want everybody to know that when we call ourselves confronting the complex podcast or whatever, which is a mouthful, uh, that's really where we're coming from. So, you have anything
Yeah.
to add to that, Janelle?
I just want to add that we aren't stating that the patients themselves we're not confronting the complex patient, right? It every time a patient comes to me, they're like, "Oh, you've probably have nobody in your practice like me. I react to everything. I have so many health issues. I am the most complex, right? I overwhelm my medical doctors." And those are my exact patients, right? Everyone thinks that they are super complex, but the truth is we are complex beings inherently, right? We are not supposed to be a linear, easy to decipher machine, right? We are complex by design. And so I just feel like being able to confront that and say, look, we're gonna expose what is complex. We're gonna bring it to the surface. We're gonna treat what we can. That's obvious. Sorry, my voice is going. And so this isn't directed, like you mentioned already, this isn't directed at the patient,
Mhm.
this is directed at the system, the totality of everything that we
Yeah,
talk.
no, good point. You know, it's the system at the end of the day, really.
Yeah,
Uh, Most of the time, we're not trying to individually attack people or confront individual people. We're here to really
absolutely.
talk about systems of the body, systems of medicine. Uh, I don't like to talk about political systems, but they they get
Those
in
are
there
really
somewhere.
complex.
Yeah, they're extremely
Yeah,
complicated. I'm
that's,
sorry to say.
yeah, yeah,
And this week, as far as current events go, I won't talk about this too much, but there's just been all this talk, as usual, of, settled science and settled paradigm, and, that we kind of we can live more comfortably in this world, thinking of it in simplistic terms, thinking of things in black and white, thinking of things in absolutes. But truthfully, if you're out there in the proverbial trenches of medicine, how much does that serve you? And then how many people get left behind in the process of trying to force a square into a circle every day?
well, you and I see those patients that are left behind. I always
Hmm.
tell patients, there's a nice accent. I
Oh,
always
yeah.
tell patients that they don't fit the algorithm of conventional medicine, and that's how they landed in my office, right? If you don't fit the algorithm, then they don't know what to do with you, and that's justifiable. I get it. Like I've had doctors look at me before and say, I don't know how to help you. Like you just don't fit. I went through everything that works, and you just don't fit. So that's kind of,
Yeah, what
my
does that
background.
lead to? I mean, it leads to really negative interactions and trauma and behaviors like gaslighting is a classic term that gets thrown around.
Yeah.
You're told that your experiences are not, legitimate. They're not
Yeah.
real, or there's something that you don't believe that they are, so to speak.
Thankfully, I didn't necessarily get gaslit by the doctor that said, I don't know what to do for you. I mean, I remember having an appointment with my primary care doctor when I was like pretty sick, and
Hmm.
he unscheduled me. Not
Oh,
because he
there.
didn't
Okay.
like me. He didn't know what to do. His nurse called me and she's like, he doesn't know what to do with you. And
I see.
I was like, I appreciate that. Like I
Well, that's
actually didn't even
honesty.
take it offensive because he just didn't know. He wasn't saying your condition isn't real. He did kind of hint at that at one point. But for the most
Yeah,
part.
not
It's just
everybody does use the ancient art of gaslighting. That's like a sort of
right.
a selective thing that happens sometimes.
Yeah,
And honestly, I think it comes out of frustration of that individual.
absolutely.
It comes out of like my tools aren't working. I don't have a screwdriver that fits that,
It's
type of
about
image.
them. It's not about the patient, right?
It
It's about
is.
their own sadly, it's about their own ego. Mine too. Like sometimes I get frustrated if I can't help somebody and I just have to say, you know what, we need other eyes on this. We need fresh input on this.
Yeah. And
I'm
that's
not
it.
going to
I
help
mean,
you.
at the end of the day, I mean, that's what we're kind of where we're coming from too, is that there's a lot of complexity in managing any human that's in front of you, and you really do hope that that human has a lot of natural drive and ability and what we call the vital force. We're going to talk about naturopathic principles here in a little
Yes.
bit, I promise you.
I'm
Uh,
excited to talk about that.
and that the folks that are really vital, so to speak, as they say, are the ones that can do a lot of their own work and a lot of their own regulation. Those people with sometimes with the simple passage of time, an ailment improves and heals itself. You don't need a lot there. It's the people that you need to do more than just one thing with. You need to maybe spend a little more than a few moments with, that you need to take a little more consideration with, that we're really, referring to more than not. So anyway, that is to say,
And
I just
on
wanted to
on
pause
that,
for the cause. Yes, please.
you mentioned that, and I don't want to delve into this too much, but like I will say that our naturopathic principles, that tincture of time, kind of letting time take its course, like or subtle interventions used to work pretty okay in some cases, right? But I
Mm.
would argue, and I know we've touched on this in other podcasts, so I encourage people to go listen to some others where we have delved into this a little bit more. But in a post-COVID world, patients are not responding to the same level of therapies in the same amount of time. So I think that that's really important. Like the successes that I would say I had in treating certain conditions pre-COVID is very different now. And I don't know if that's true for you.
Well, I
Sadly
can
true.
attest that like 10 years ago, things definitely felt to me a little easier to rely on some of that level of predictability, I guess, in terms of
Exactly.
the
Yeah.
momentum of healing, the moving train of healing, being forward and just getting a few things arranged correctly, identifying and naming those few things, and then just sort of, giving it time, which is sort of the nature of a lot of these more sustainable medicine systems that were very rarely hitting a quick fix home run in terms of things, unless you really are having to intervene on symptom suppression or something like
Right.
that, which we'll talk about that today too. So yeah, it has gotten more difficult. And I mean, that was sort of the impetus for us maybe even starting this podcast, is that we're realizing that things are not getting less complicated, unfortunately, that they seem to be
Exactly.
getting more complicated. So yeah, I think we need to talk about that. I think if we avoid talking about that, we are only going to slow down our progress in terms of our understanding and ultimately, of course, the much needed changes that need to happen within these systems that we're speaking about. So, yeah, it's
All right.
kind of where we're coming from. So, without further ado, let's talk about naturopathic medicine. Yeah, I know. That's what I guess that's what we are. Janelle and I are naturopathic physicians in the state of California. I'm not even allowed to call myself a naturopathic physician. I have to be called a naturopathic doctor. The fact of the matter is, both of us have doctorates in naturopathic medicine. So I can tell you that at least. So for all those other states that don't acknowledge that or want to maybe throw me in jail, I'm looking at, I won't name you, but I know you're out there. Uh, I, let's talk first a little bit about, I think, let's talk a little bit about our education first, just because I think it's worth just doing a quick overview. And then we're going to dive into the naturopathic principles a little bit and how uh, why I think and we think that our basic philosophy of training and understanding is incredibly valuable in the field of complex chronic illnesses. And I think just valuable to help evolve and change the difficulties in the current paradigm of medicine. So
Can
there's
you
a lot of hope.
can
Yes.
you differentiate for the audience, like what is a naturopathic physician or naturopathic doctor versus a naturopath? Because
Ooh.
It's a
Yes.
very unregulated world out there.
Yeah, and honestly, I mean that was why I was thinking about jumping into education, but it is about education partially. But okay, let's just break it down real quick. Like, there are folks out there in this world, and I'm sure they do good work in some ways. I mean, I'm not, attacking any
Sure.
individuals here, but there are folks out there that just call themselves naturopaths, and some of them can even, in some states, get away with calling themselves doctors. But they have a different education than we do. They don't go to a typical 4 to 5 year, in some cases, medical school that's accredited
Accredited.
and
I
has
just sound
much of
accredited.
the same sort of medical school basic training, just with which is, all the health sciences and the clinical sciences and all that good stuff. And then with the edge of and the philosophy of naturopathic care, which is more naturally medicine minded and follows a set of important principles that we will soon discuss. The difference is that some of these naturopathy individuals don't necessarily go to accredited schools. They may not have the same intensive medical school experience as far as like our first year was, cadaver lab, anatomy, physiology, and all the usual histologies and
Right.
various things of this nature. And so, but they come out, and in the states where we're not licensed, they're sort of at an equal footing as we are in terms of what we're able to do, what we're allowed to do, and how we're able to operate. And so it becomes incredibly confusing because you don't really know what you're getting exactly. You're going to get somebody that's going to be more attuned to natural medicine, that's for sure. But the kind of doctors that, we're talking about that are ourselves have a different level of training. And originally I think there were interests that were trying to get us to be the missing piece of primary care, to be primary care physicians, I think was one of the goals, to be general practitioners. So it's different than sort of being like, hey, I'm going to help you clean up your diet. Here's a few supplements. Here's a few herbs. We were supposed to be actually operating as a bridge, at least the way I see it, a bridge in um, conventional medicine to natural medicine, and well, I guess what we would call integrative medicine.
Integrative, yeah,
Hmm.
for sure.
Yeah, so I mean that's my biggest understanding of the difference, and I mean that just brings us then to uh, our education. I went to Bastyr University in the Seattle, Washington State area, Kenmore area, and Janelle, you went to
I went
UNM
to
Farmington.
Bastyr in San Diego for my first 2 years, and then I
Oh,
transferred to Oregon, yeah, to be closer to
right.
family. And I transferred to Oregon and did my remaining 3 years there
Okay, cool.
at
Yeah,
NUNM.
NUNM, formerly NCNM. Yeah, so
NCNM.
that's
It was
an
NCNM back in
It
my
was,
day.
yeah. National
Yeah,
College versus National University.
yeah,
That was the Portland school. So those were
correct. In
some
Oregon,
of the
yeah,
big schools there. There are enough schools that you can remember them on a hand to count probably in this country. There aren't that many.
for
Uh,
sure. Especially
there's,
now we have SCNM, which is now Sonoran,
mhm.
and then
Oh, they
Bridgeport
changed too.
closed, right?
Yeah, there's no Bridgeport anymore. I think
Okay,
there's a new
so now we
program
have
starting in Portland, Western
Western States. Yeah,
Western
the
states. Yeah,
chiropractic college now has a naturopathic program as well.
that's
So
right.
Portland has two, San Diego, Seattle. Yeah, you're right. One hand.
I know. And then, I mean, there's one in Chicago, but I'm not actually sure that it's accredited. I was trying to look it up the other day and I couldn't
Huh.
really see that it was, but it is
You
like
know
a
what the
four
name of it
year.
is?
I believe it also has a national in it somewhere.
Okay. Yeah.
It's like I
Yeah.
can't keep track. I think I can keep track of five things, but supposedly. But yeah, being I'm formerly from the East Coast myself, but being on the West Coast as long as I have been, I entered medical school in 2007. So I've, kind of lost a little bit of track of what's going on in the Midwest. But I think there is
Okay.
something going on there in Chicago area. But there's no licensure in that state. So it's always been sort of odd to me because the states that do have these are the states debatably with the best scope of practice generally and have the richest, I think, history there. They've still had their struggles, which we'll get to. But yeah. So the education, as mentioned, it's pretty standard in the first couple years. Like you wouldn't even
Okay.
really know. I mean, you do have a few philosophy class and stuff like that to kind of keep it fresh and keep it interesting in the first year or so. But generally speaking, a lot of the first couple years are basic sciences like any other medical school. So
Right.
as I mentioned, we all went to the cadaver lab, got all the lovely formaldehyde exposures, and felt good about that. And it's a really important part of the education, by the way, and I really do appreciate all the people who've volunteered their bodies for that.
Hmm.
So thank you out there.
Hmm.
And then, after that, we entered in the clinic. But there's a clinic in Seattle area, and there's a clinic for the university in the Portland area, and probably the same in the Phoenix area.
Hmm.
And that's, where we start to see our patient contacts and various things like that. We were required to preceptor with other folks and hang out with them and all that kind of thing. Where it got sort of different, I guess, was that we had specialized classes in botanical medicine, in other natural interventional therapies, like even hydrotherapy or water therapy, which we'll talk about
Yeah.
sometime.
And
And
physical medicine, similar to chiropractic
yeah,
adjustments
yeah,
or
similar to manipulations.
manipulations.
Yeah, and structural medicine. And it's interesting. A lot of the roots of naturopathic medicine and chiropractic, there were shared roots there somewhere at
Of
one point.
course. Yeah.
But now things are a little bit more hostile. I hate to say it, but it's like, yeah, there's a little more competition there. So we're not really allowed to do adjustments in every state. I can do adjustments in Oregon. I can do adjustments in Washington, but I can't do them in California. At least not with any kind of force behind them. They can be, if you move the joint, something happens, but you better not like try to move that joint.
Right.
So so you'll see. It's funny because I mean, what profession out there can you go through such vigorous learning and vigorous, honestly, pretty high expenses, which we'll get to,
Right.
and then come out and not really be able to do what you're taught. That's it's an interesting conundrum that we're stuck in, and we'll elaborate on that further later. But
Yeah, it's really that crux of every state is kind of on its own as far as licensure and scope expansion and all that, and it's really varied from state to state. I mean, that's something that everybody should notice. What I can do in Oregon, I can't necessarily do in, Montana, right? Or in
yeah,
California.
and that
So,
there, I mean, and maybe somebody out there knows of another profession that's like that. So I'm not saying that there aren't. It's just that like our profession is sort of unique in that way, especially amongst medicine. Because if I went to be a nurse, I could almost get a nursing job in any state. I mean, I
right,
could. In fact, they're in such high demand, I definitely could. I could be a traveling nurse and work in 5 different states in a year if I wanted to.
exactly.
So for myself, was I going to be able to go back to my home state of Pennsylvania and open up a practice and do that? Not easily.
Not easily,
So
right?
it is a little bit different in that way. The other thing is residencies. It's important to address that elephant in the room too, because one of the criticisms that we get oftentimes is that we don't go to vigorous residencies. It's not that they aren't available or that there aren't residencies out there. It's just that like there aren't a lot of opportunities for the number of people that we are. And there aren't that many of us, actually.
There's only I just saw a statistic that there's only as far as like available residencies to graduates, about 10% of the graduates have the opportunity to do a
Mm,
residency. Like that it's a finite number of available residencies.
yeah.
So 90% of us aren't able to
And it has to
benefit
be
from that.
because we end up all inevitably. The truth is a lot of NDs end up specializing in some way. I mean, there are some of us that have retained sort of a general practice mentality, but a lot of us, truthfully, have started to get into specialty areas, for adjunctive care. Like I'm a gut specialist. I'm in more into gastroenterology. I'm more into hormones. I'm more into nutritional therapies or things like this. And that makes sense. I mean, it makes sense. That's how most of medicine is. But then if there's a limited amount of residencies, there's even a more limited amount of the residencies that would be most valuable to you in the direction that you want to go in.
Exactly. It's pretty
So,
limited. So
yeah, unfortunately, yeah.
And
So,
that is something that I really hope, I was going to talk about this towards the end of the podcast, but I really hope that that's something that our profession moves to, that number one, we have more residencies available and that everybody takes part in one. And then I do see that at some point residencies are going to be an expected part of the naturopathic education.
yeah, and right now the reason why it hasn't become a requirement is simply because of lack of access, as mentioned. And if there was a time when we would be allowed to, for example, like osteopathic physicians, apply for more conventional type residencies, like say we wanted to, I don't know. just be a family medicine practitioner? Why couldn't we get a family medicine residency?
Right.
If those were allowed, then we'd have way more opportunities. So until we are quote unquote allowed, or somehow there's a giant influx of us out there that start residencies, which I don't know if that's going to happen
I
right
don't know.
away, then we couldn't really be required to do that, because how can you do something that you can't do? You'd basically just be hamstringing a whole profession of people that are coming out of school trying to work, that kind of
Right.
thing. So
Right.
that's is what it is. Um, so yeah, so anyway, why don't we any comments you want to make about your particular education, Janelle? Anything you'd like to say about it?
I really valued my education, especially like the depth of it. I felt like we had a really nice, well-rounded education. What I would love to see the naturopathic schools really push is that business education.
Ah,
And
yes.
that is something that I am learning about more and more right now. Like, right, even 8 years post graduation, I am learning more and more about the business aspect and what I didn't learn there. There should be a package that you graduate with, not only classes, but a package stating, have you done this? Have you set up this? Have you set up this? This would be your next step. Just I need
Yeah,
it black and white. I need
yeah.
to not figure this out later that like, oh, I really should have had this tax strategy and I really should have had this tax. And these were not things that we discussed. And
Yeah, I
it's
mean, we don't have as many opportunities to come out of school and work within a system. Like maybe people come out of school and go to the residency already, and then maybe they continue then with some kind of system, and it's a way to kind of get their
right,
feet wet and start. And maybe, and honestly, the truth is there are a lot less overall private practices, even conventionally nowadays. If you
right,
really look at it, certain hubs, certain areas of the country, maybe you'll see more of them, but across the country most physicians and practitioners of different varieties are working within systems. So once again, it comes down to like if we don't have system availability, we don't have residency availabilities, our job choices are few and further between. So
yes,
we are sort of in a sense, it's a necessity to become business savvy. You have to
it
be
is.
able to make your business in order for the average, I'm not saying some people can't exist within other practices and be successful, but in order for the average population of NDs to be successful, it's very much needed. I can say that,
Yeah,
for
to
sure.
be business. And I wasn't going to talk about this at this time, but at the end of the day, you mentioned it with the conventional medicine. We are seeing a pretty significant, consistent trajectory as far as a decline in private practices. And many more people are working for institutions, right?
Yeah.
Major medical providers. And naturopathic doctors, we can't join those forces easily because we don't have, and I say easily, it's not that we can't, but I would say routinely, naturopathic
Yeah.
doctors have been excluded from these institutions because we don't have federal recognition, which is a
Yeah.
huge demerit. We aren't primary care in all states, huge demerit, right? So
Right.
some of these things are really kind of we need to grow, right? We need to grow this
Yeah, we're
profession.
not allowed to get boarded either. We're not allowed to be part of a board. We can't be part of the board of family medicine even, we're not allowed to. Even if we could go through all the rigorous trainings and everything, and even if we're technically, trained and qualified enough, we're not included in there
Right.
right now. So,
So it's significantly, I had no idea when I moved from Oregon, went to California, matriculated in our classes, and it was probably a good month or two, and we were talking about licensure because they started talking about DC fly and some of these things. And I didn't know that NDs weren't licensed in every state.
mm,
I mean,
wow,
talk
really?
about
Wow.
like shocking, eye-opening because I'm from Oregon and these
Right.
are everywhere. And we
That's
had full
true.
licensure. I mean, like
That's true.
I had no idea that we didn't have federal recognition because I'm not on Medicare, right? Like it just some things that I wasn't told and I didn't know. And
Yeah.
so I'm just like, wow, like it was eye-opening to me. So
Yeah, I mean,
I
for
just,
all those out there thinking about getting into naturopathic medicine, talk to and get your
yeah,
questions answered. Be curious. Yeah,
be curious.
there's a
Yeah.
lot that goes into it for sure. I mean, there's a lot of adversity you're going to have to deal with, but I mean, the education is great though. I mean, let's dive into the merits of the education and why
Yeah.
we think it's valuable and why we think it's been, a major advantage, I think, for working with complicated chronic illnesses too. So let's go over our naturopathic principles, and I'm going to kind of,
Mm.
pull
Which
them
one's
up
your
and go,
favorite? Tell
which
me which
one's
one's
my
your favorite. I want to know.
favorite? Ah, that's a good question. Because I like every one of them in their own
I
way.
do too. I do
I
too, but
think I
it has
always
to be.
think that the vis medicatrix naturae, like the healing power of nature, always sounds so powerful to me, and people probably think it sounds kind of like hippie or whatever, but I
Yes,
actually
it
it does.
is. You're right.
I just think that like we have to remind ourselves that we are a part of nature, first of all, that like we're yes, we're human beings and we have all this big brain stuff going on and we have all this technology and we have all these like artificial environments that we create and everything. But at the end of the day, we're part of nature. I think that that's really important and that every day that you wake up on this earth to me, I mean, not to be cliche, but every day is a gift. Like look at how well your body is regulating all the adversities that are out there. I mean, there's bugs everywhere, there's viruses everywhere. Your body's full of bacteria and all kinds of crazy things. And it's like whatever, I'm doing fine, I'm feeling good. And it's like maybe I'm not always optimally 100% as good as I'd like to be, but
Right.
you'd be surprised how well humans have been able to adapt to adversity over the years and over the centuries, over the millennium, and if you want to go way back. So I do think the healing power of nature to me is just really profound because I think it just sort of puts us back into that. We got to remember, just a reminder to me that we're
Yeah.
part of nature and that we do have significant innate self-healing potential. And it's empowering to me. And that's what I really want people to understand is that this, you should feel empowered to heal. That it's,
Yeah.
it's not just like you're gonna throw a bunch of stuff and like band-aid your symptoms and stuff, man. It's like, no,
Sometimes I do that.
yeah,
Sometimes
well, there's a time and a place for everything.
right. Although
But
a word that comes to mind is awe.
yeah.
I have like this awe, this reverent awe for our body. Like you mentioned cadaver lab. And I remember like when we were looking at the nerve system in the cluneal nerves in the body. And I remember like just being in awe. I went to bed that night just like, can you believe the nervous system? Like you could just see the muscles innervated. Uh, Fascinating. Totally fascinating to me.
Oh
I
yeah.
was
I
in
mean,
awe.
I was in awe just about how similar we all really truly are. Like there's always these little anatomical variances from person to person, but whether you're a male or a female, there's like an analogous structure. There's a structure that looks similar that just developed in a different kind of way. It's just like to me, yeah, I was in awe at the same time, just for various other reasons too, just of
Yeah.
like how united we all really are, like how much we are all we're more alike than we are different. You know, and yeah, it doesn't mean each of us doesn't have their own, cool little differences, but you know what I'm saying.
Right.
So,
Right. Right.
um, so that's my favorite, but so I like to support that any way I can, and there's different ways to support that therapeutically, of course, because I mean sometimes it's just helping the foundations of health, which we'll get to, and just helping people have a cleaner diet, help them manage stress better, help them sleep better. I mean, there's so many different things you can do to optimize that healing potential in an
Right.
individual, just at a very, very basic level. So I'll name a few more of these principles. The next one on the list is tole causum, identify and treat the cause. So we'll see some Latin up in here. So I mean, this one is pretty explanatory, and I think it is sort of like, well, why wouldn't we want to, treat the cause of an illness? I think what happens a lot of times is illnesses this day and age, especially, a lot of them are what we call syndrome type diagnoses, is that they kind of list or they pattern signs and symptoms, so objective findings, subjective reports, and other things like this, and put it together into a label. like chronic fatigue syndrome. Okay.
Yep.
Due to, uh, I don't know. So I'm just going to call it idiopathic. Whatever. So how many diagnoses say idiopathic? Idiopathic just means I don't know.
Right.
Uh, you know, so I think that treating the cause is important. If you can understand the cause when the cause starts, if you can treat the cause early on in a process, possibly, sometimes it's a simpler answer. If you don't know what the cause is and you just band-aid or suppress the symptoms, as they say in naturopathic philosophy, the pathology goes deeper
Right.
and then it becomes more complicated.
I feel like we're starting to see this play out more and more, like that whole root cause. Like you and I both treat conditions like chronic Lyme disease, for example. I'm just going to use
Mm,
as an example. I
good
would even
example.
argue like that Lyme disease isn't necessarily the root cause, right? Like
Yeah,
why is your body more susceptible to Lyme disease? Lyme disease is pretty prevalent in our society, and
right.
people aren't necessarily always affected by it. Their immune systems are tackling it for whatever reason, but like what thorn is in your foot that is causing Lyme to be more active in your body, almost losing tolerance to be able to fight it off. So, like, root cause goes even deeper, right?
It always goes deeper. I
It's
mean, that's really my whole point is you can say due to, maybe this, but then there may be a multitude of other factors. And then the further you
right,
go down that rabbit hole, perhaps the closer you get to the original sin or the original issue. But
right.
it's like,
Yeah,
but oftentimes it is really multifaceted. So that makes it incredibly complicated. And I think it's easy to throw up your hands because you're like, there's no way to prove that this MS illness was even caused by Lyme disease or something like that, or caused by toxic mold or something like that, or whatever you want to say. It's like, well, yeah, but the more we understand this, the better we can help heal the individual because you can work your way backwards a little bit. So if the
right,
most immediate insult was Lyme disease from a tick bite, half year ago, maybe treating that first would peel off a really important layer. You don't know that.
right.
So the more we start to make assumptions by letting go of cause because cause is too complicated to find. We don't have the good enough tests. We don't have time. We don't have,
Right.
enough of an understanding. We don't have a good enough, I don't know, whatever.
Yeah.
It's not good
And
enough.
like you, like I run like we've talked about this before that I cast a wide net. I do a lot of testing and I might get active viruses in the body, pathogens, toxicity, genetic stuff might come up positive. So I might have a whole slew of stuff, but that doesn't tell me which one is taking priority, right? Like
Unfortunately, not. It's not that easy.
right, like the cause, sure, they're all kind of playing together, right? But like it doesn't tell me priority. So that's another anyway.
I know, and
Root cause is tricky.
it is. Root cause is tricky. So I mean that principle is very important, but perhaps in some cases it's oversimplified. So,
Yep,
it
for
is
sure.
important to discuss that a little bit. And then the next one, first do no harm. Primum non
Mhm.
nocere. Yeah, yeah, yeah.
Yeah,
So,
yeah,
I mean, I'll elaborate on I guess the sub definitions here a little bit. It says here, utilize methods and medicinal substances which minimize the risk of harmful side effects, using the least force necessary to diagnose and treat. Avoid, when possible, the harmful suppression of symptoms, and acknowledge, respect, and work with the individual's self-healing process. So you can see how that sort of
yeah.
relates. So, I mean, first do no harm. What does it mean to you? Because it is a really important one. And I think it gets thrown around a lot. And I think sometimes people are like, well, after the fact, hindsight's always 20/20. Like, why the heck did you harm that person? Like you totally didn't think about what you were doing and it was really terrible. So how do you navigate first do no harm in real clinic practice?
Well, the first do no harm is really looking at the severity of the illness, right? And the intervention level. And I know we're going to talk about that, the levels of intervention. Like should I come in with a gentler therapy right now, or is this the time to use something that's a step up, a little bit more significant therapy that we're going to see results faster?
Mhm.
Um, First do no harm is something that I think weighs on me every single day. If you don't think about first do no harm every single time you're with a patient, it's time to revisit it, right? I mean,
Yes.
it just is. And I think about it every single day. Like that's probably my
Moment to
number one.
moment.
Moment to moment. Like, is this benefiting or is this harming? this is
Yeah, because I mean, there's a concept in naturopathic medicine, and it gets thrown around in a lot of other circles too. But the concept of like, they used to call it a healing crisis, but I think it has a little bit of a nicer word now. I forget what it is. I'm terrible, but it's basically like a healing reaction or a healing response. And
right,
so it is true in some cases. And in the case of Lyme syndromes, and even before that, it was defined in syphilis, there's this thing called the Jerisch-Herxheimer response.
right,
And that, sometimes there's a worsening of symptoms. Debatably, if you're following naturopathic principle, the stimulation of the vital force, you're actually getting the system to respond to something it has not been responding appropriately to. It's like if you should have had a fever, but you didn't, and then you might go and use sauna, or you might actually try to stimulate immune system function to get the body to deal with it. And they use that in conventional medicine too, when they give people interferon or they give them immunotherapies or something, to try to get the system to naturally take care of it. So it's not that these principles are completely foreign or anything.
right.
So yeah, so there is that, but there's also like a lot of our patients are very sensitive, and some things, with the best of intentions, with the best of calculations, if there was such a thing, uh, will agitate or exacerbate symptoms and that kind of thing. And at the same point, they may not respond as favorably to the lower force interventions, or maybe in a lot of cases intolerance to foods, just a
Yeah,
lot of different things like this. And so first do no harm is, to me, I agree with you. It's to me sort of like a moment to moment check-in, and what are we doing here? Is what we're doing
yeah.
helping? Are we seeing forward momentum? Momentum and progress in chronic illness is not always linear. It's not this beautiful upward arc of, it's like this
Right.
like bumpy road, and it's like that can be really difficult.
And
And
even talking about like antibiotic use,
yeah,
like it in some of the conditions that I treat, I use antibiotics and I have to use antibiotics and sometimes for an extended period of time. And I will say that that first do no harm, like weighs on me heavily, right? Like, are we seeing a positive trajectory? Are we holding with symptoms that were once debilitating? Potentially, right? And like, uh, are antibiotics harming the gut microbiome? Yes. You
yes.
know,
Hmm.
yes, unequivocally, right? Like they are harming the gut microbiome. They're also attenuating the pathogenic bacteria, right? They're reducing that or stifling it or suppressing it to where we can work in other areas to kind of help build up this individual to where they don't have to rely on them, right?
Right. And we're going to get
Um,
to talking about the concept of therapeutic order in a little bit. And that's why I sort of alluded to already that there's a time and a place for everything. And sometimes
right.
you have to use more toxic therapies to get people into a little bit more of an aligned place to heal, and get that momentum that we were talking about. And it does come at a price sometimes, and you have to recognize the price that it comes by. If you're going to do a surgery on somebody, what's that going to mean? They're going to have scar tissue, they're going to have a longer recovery, they may have a risk of
Yep.
infection. I mean, there's so many things that can go there. And that's why we were just saying it's a checks and balances too. It's like we got to check in with ourselves as practitioners when we're thinking about this, and we have to balance the risks and the benefits sometimes. And I would go, and this maybe is the next principle I could talk about, but it's also important to educate the patient of the risks and benefits of
Mm.
everything. And that's actually one of our naturopathic principles. It has to do with what they say,
Doctor
doctor
is
as
teacher.
teacher, also
That's my
known as
favorite.
docere. Yes,
Hmm.
docere. And it says here, naturopathic physicians educate their patients and encourage self-responsibility for health. They also recognize and employ the therapeutic potential of the doctor-patient relationship. Yeah, there's
This is
power
my
in that.
favorite. Yeah,
Well,
this is my
tell
favorite.
tell
And
me why this is your favorite. I think it's a good one too, by the way.
it's I think it's inherent in me. Like I am a natural born teacher. I used to be an educator, a middle school science teacher, right? That
Oh,
was
right
a
on.
previous profession, which is great. I loved it. And at the end of the day, I just wanted to do something different. So I
Yeah.
went into naturopathic medicine. However, that inherent wanting to teach people, and it's empowering, right? Like they have to know, so they have all the vital information to where they can glean from other people, from other sources, right? Um, what else was I going to say on that? That this is why our appointments are 1 to 2 hours long. I can tell you that, right? Because it's not like, okay, I want you to take this, or, I want you to take this supplement, but you could have a side effect. If you see this and this and this, then, maybe back off or expect this to happen. And so we have a lot of those conversations. It's never just straightforward, right?
Right.
Um, I don't want anyone to be surprised. I don't want anyone to leave my office and take something and go, whoa, she didn't tell me about this,
Yeah.
So
And patients mostly appreciate that. Occasionally, I know some of you out there, if you're listening to this, it can be a little overwhelming with the amount of
yeah,
information that I give sometimes.
yeah, same.
But I think for the most part, it's very well appreciated, and it's different than what is typically done with the as we mentioned the prior podcast, the short duration medical visits where you don't really have time to really tell your story, and you don't really have time to get much of an explanation for why you're being recommended a treatment or prescribed a drug therapy or even a surgical consult with somebody, like I'm not saying that time's not offered, but it's hard sometimes to do that with the complexity of some of these types of syndromes.
Yeah,
So it does enhance it doesn't just enhance compliance because we don't have to think about it that way. It enhances, I think, the healing potential of the individual because they are understanding and consciously and willingly accepting the treatment into their body, into their life. And I think
right.
that there's power in that. You can call it placebo or whatever you want to call it, but it's like
There's
there's
power in it.
power in that. Your therapies will be more effective. That's why
Yeah.
in future podcasts we'll discuss the double-blind placebo-controlled situation, but where it's
And
where its limitations may be, but anyway.
it's important to note that this is the reason why I personally wanted to start a podcast, especially with you, right? Because like I wanted to things that I say all the time, nuances that I say to patients all the time. I wanted to put it in podcast form because it's overwhelming. They have a hard time retaining it, right? Whether it's medication interactions or it's, other topics that we discuss, it's just a lot to absorb. So if we put it right here, they can access it, right? This is
Right.
to me, this was an educational forum to get it
Yes.
out there, right? It's kind of, I just made that connection that it's my favorite thing, and this is the whole purpose of
That is
why
the
I'm
whole
here.
purpose. That's
Why
why
I'm here.
that's why we're doing this. And that's why, I started doing this with my employer too and, Gordon Medical and everything. That's why we started all this is education. That's really the core of all of it. So
Right.
we're aligned.
Yeah.
Um, so yeah, that's a good one. And then we have treat the whole person. Apparently there's not Latin for that one. Am I wrong? No, there is, right? Oh,
Yeah. But
I forget.
I don't remember
Okay.
what it
I
is.
forget.
Like it's been a long time.
I forget
I'm
the
not being
Latin.
tested on this, right?
No, no, no.
Good.
But here, I'll just read a quick definition about what the whole person is suggested here. Naturopathic physicians treat each patient by taking into account individual physical, mental, emotional, genetic, environmental, social, and other factors. Since total health also includes spiritual health, we mentioned that on our first podcast, naturopathic physicians encourage individuals to pursue their personal spiritual development. So, yeah, treat the whole person. That's a
Treat
pretty
the
full
whole
one, isn't
person.
it? I
I,
know.
I feel like I feel like it's so my everyday that I don't even think about that. Like
Yeah.
that's implied, but I guess it's not necessarily implied when you go to the doctor, right?
No, I mean, I
What
think
we're
all of
doing.
us know a little about a lot. It doesn't mean we're what is it called the jack of all trades and the masters of nothing when it comes to the body, but
Right.
we can understand the connectedness between the different regions of the body and the different presentations and the different aspects of an individual's health, their spiritual health, their psych, whatever, their social health and different things inclusive to the physical body that's in front of us. And so when you start thinking of that as a whole, yeah, you kind of just get into that mindset and you kind of just sort of become that. You become a whole quote unquote holistic practitioner, uh,
Right.
perhaps with a W, it's actually with an H or whatever.
Right.
So, but you're treating the whole individual, and as a result, I mean that's why there was a certain faction of us and that felt very strongly that we could step in and be effective general practitioners for that reason is that if we can understand the whole person to the best extent possible, then we can know when that person may need, things that we can handle better on our own as first line therapies and when they need higher interventions, when they need referrals for a neurologist or something like that. But if you just compartmentalize the system. I'm not saying all physicians do this, but
Right.
if you look even very superficially at from a multi-systemic approach, then you're going to find yourself with these complex illness patients punting quite a bit. You're going to
Oh,
punt to this
absolutely.
specialist, you're going to punt to that specialist, you're going to punt to that specialist, and you're going to give the person the runaround for like 2 years or something like that.
And this is why we have siloed medicine, right? Is
Yeah.
not seen, and I think that we are starting to trend back. Even conventionally, they're
We are.
starting to see that siloed medicine is really it, as good as it is to specialize. We're doing our patients a disservice, right? Like you said, it exhausts the
Yeah.
patient to have multiple people having input,
And if they're
and
not communicating with each other, it's just telling your story over and over again and missing pieces. It's not a building process. It's just like I'm starting over again and I'm starting
right,
over again and I'm starting over again. So,
yeah.
yeah.
And I'm thinking of a few patients now that like over the course of a few years, like I can remember conversations where it was pretty heavy pharmacology, right? We were just doing medication management, right? And that was the kind of the crux of our visit. And I remember other visits with the same patient where I was connecting them with a church or
Yeah.
a pastor to talk to or a meditation practice or, something like
Yeah.
that. It was very spiritually focused versus pharmacology focused. And I was like, it feels weird, right? Sometimes it even feels weird. Like, is this like, but it's treating the whole person, you know?
It is. And yeah, and there's no shame in that. And it's also like, I think one of the criticisms that NDs do get a lot too is that people think we're dangerous because we're operating and wearing so many different hats at any given time, and that like we're not gonna send people to specialists or something. And I think
Right.
that's not true, really. I mean, most of us understand our own limitations, and I
Yes.
think at the same time, when you treat the whole person, it doesn't mean that you need to do everything. When you treat the whole person, sometimes it means I think that you need support here and I'm not the best person to support that all the time. Like maybe in the cases of spiritual health, it's your pastor or something.
Right.
I'm not going to play your pastor. I'm not going to pretend to be your pastor.
Good
And
point.
and I'm not saying, I'm just saying that like that's a criticism that we get oftentimes is that when we try this whole jack of all trades thing, it's like, no, we're just really trying to understand as much as we can about your whole body, about the different systems.
Exactly.
And we're not compartmentalizing them. We're trying to understand the entire you. But with that comes to me anyway, the advantage of knowing when we have to intervene at a higher level too, and when I need to refer you. And I can write a real nice referral because I know so much about you and sort of where I want us to really focus and hopefully, communicate with that particular provider at the same time. So just, anyway, wanted to clarify that a little bit from my own.
No, I think that's really good. And I think knowing the limitations, right? Like, is this
Yeah,
something that I need extra eyes on this? I have a lot of patients that want me to take care of everything. And I just can't,
right.
and that's not good medicine. Sometimes we need additional eyes, we need additional input, right? I see that a lot with psychiatry. Patients are like, well, can't you prescribe me an SSRI or can't you prescribe, you know, something, to help me sleep? I can, but it's really best if somebody that's, specializes in this has eyes on you, right? They're going to know
Yeah.
more about, the way these medications work. And anyway, so I don't know about you, but I usually always require if somebody has like a psychiatric diagnosis that they have a psychiatrist, an active psychiatrist on board or a
Yeah, I mean,
psychologist for
rarely. If
helping
I
with
if
counseling.
if I feel that I'm using psychiatric meds for a temporary amount of time, sometimes that in a fairly safe setting, which I know
Right.
it's completely individual case by case.
Totally.
I may do that while people are transitioning, but it has to do with getting proper access most of the time. I have to admit that like if I'm ever stepping in on these different areas, it's because I'm trying to get them somebody who will one listen to them and actually like or even just talk to me and have a conversation and maybe put some heads together and that kind of thing. And unfortunately, sometimes with these complicated situations and these folks, they don't have the access to the practitioners that they
Mhm.
need at that given moment to really help them because they've usually been to 3 or 4 psychiatrists and it hasn't really worked. So the only time I've really stepped in, I have to admit, is for like a temporary transitional, like we need to really do better here. And to
And
me,
yeah,
it's all mechanistic stuff too. It's all like, what do I understand about your condition? What do I understand about your nervous system? What do I understand about your neuropsych, your
yes.
neurologic, physiologic, and psychiatric continuum that I can sort of best serve in that regard. Yeah. So anyway,
Sorry, I, I so appreciate that you said this because like I give bridge dosing all the time, right?
yeah,
Like I'm going to start you on this, but I really want you to go to the cardiologist, right?
yeah,
Even though
right,
I'm going to start you on, right?
exactly.
And
Yeah.
like
And that's common in conventional
it's
primary care.
common, right? But
Yeah.
I totally agree with you. I do not withhold medication from a suffering patient, you
Yeah.
know, before they're yeah, see a
Right.
specialist because as we know, access to specialists, number one, it's there's a shortage, right, in a lot
That's
of
it. Yeah.
specialists, and the wait times can be 6 to 9 months,
I
you
know.
know.
I mean, that's really the reality of it. And I think a lot of us out there in the proverbial trenches here really understand that reality and that we,
Right.
just like everybody else that's kind of in this, like we really just try to do our best at any given time and try to make the best decisions and, try to be the,
Yeah.
the safest but most effective. And the safety of the patient is the utmost importance here with these types of situations. So,
And I
there's
usually
a lot of
have
discussion.
a specialist in my, I don't want to say in my pocket, that sounds derogatory, but I have colleagues that I'm friends with that are specialists in this town that I can call up at any given time. And they're so great, right? They
Yeah.
can't see the patient for 6 months, but they'll call and talk to me for 20 minutes. I can give them the case and they're like, trial this, trial this, trial this. I was like, okay, great. And they give me like a few different things that I can consider trialing and what doses and things to look out for, right? So I really appreciate that, you
Yeah,
know?
that's it. I mean, you can always consult with a colleague. I mean, there's just so many ways you can kind of go about it. So,
Yeah.
yeah. So, I mean, it's important. So, yeah, treating the whole person. I mean, it's such an important principle. Like we've said, the other ones are favorites, but I say that this one is probably one of the more complicated ones to to
It is.
operate on a daily basis, especially with a very complicated individual or like a complicated illness where there's like I said, multi-systemic dysregulation. More than one body system is dysregulated, and it's usually the case. But if there's like, 10 of them dysregulated, yeah, it's not
Yeah.
easy.
And
Um,
oftentimes in that role, I feel like a care coordinator
yeah,
almost,
well,
like
you
I'll
kind of
do
end up
things, but I'm
being that
like,
way.
I need you to go
Yeah,
here and I need you to go here. And yeah.
you're like kind of like a patient advocate too, really. I mean, it's
Oh, for
like
sure.
there's a lot of that needs to happen. I mean, and that's some infrastructure stuff. Maybe we'll discuss at a future date that I feel like we could provide that's not necessarily like we don't need. It's not that we just need more physicians out there or more practitioners there and everything like that. It's that like we could have more ways to support individuals and getting the care and getting the access and getting their health in complicated situations, especially organized in such a way that makes sense. Because most of these people have brain fog too, like they have cognitive disturbances as part of their illness, and it's like, or maybe they can't concentrate as effectively. It's like you expect them to have a planner with all this organization, but they're sick. So like patient advocates, social workers. I mean, there's just so many different things that I think that like we could expand upon as a society to get even health coaches, honestly. It's like if there's something that's like complementary to
Yeah.
what we do that saves us individuals a little bit of time and still gives the same, meets the same needs that we're trying to meet.
Right.
That's win-win all around. And that creates jobs and all that kind of thing. So,
So this is kind of exciting, but you brought it up. So I have to put this shameless plug in there. That on the side, I'm kind of working on a PANDAS PANS model, creating a hub. I'm working with another gentleman that I met through another interesting series of events, right?
mhm.
And he's actually trying to help me set up essentially a hub of networked providers that would have access to a patient. It almost acts like a care coordination hub. And
Ooh,
and it's really exciting. Like I just
that
met with
is.
them last week and I would say like for a minute things were like unclear as far as the direction, but things like really connected last week is like as far as like the power within this hub can be, especially for my patients with PANDAS PANS. And
Mhm.
so I'm really excited. I mean, we aren't even in beta mode yet. We're still in the we gotta
Yeah,
wrap
much
our heads around it,
appreciated.
right?
Yeah, we
But
need more of this. We need innovation. We need creativity right now. I mean, that's something that's incredibly important.
right, but if that
Um,
model works for PANDAS PANS, then that advocacy model you mentioned, kind of a centralized hub, if you will, of information for this patient, right,
well,
can
yeah, that's it. I mean,
can be
that's what I mean. It's
replicated.
like Yeah, exactly. That we need models. That's what I mean. We need pioneers, perhaps, too.
Right.
We need pioneered systems, new systems or new ways of being. And they may start on the small scale. They may start at the community level. They may start with, a few people.
Right.
But if we can demonstrate that, I know, and we'll talk about like the whole, why don't you publish thing sometime too, because like there's yeah, it's always the pressure on us. Like, if you have such good ideas, publish case studies. I was like, I know, but we don't have time.
I
But so
know,
we
I
free up
know.
our
Who's gonna
time.
write that?
We free up our time, maybe get more people to help us
Right. Right.
take on the world.
I take on the world. Somebody wants to write up my cases for me. I'm putting that out there.
Yeah,
I'll
come
give you
on.
my cases with patient permission, of course. You write my case study.
Yeah. I mean,
Just put my name second.
it's a dream. It's a dream. We'll get there. We'll get there. The last naturopathic principle is prevention.
Mm,
So it says here, naturopathic physicians emphasize the prevention of disease by assessing risk factors, heredity, and susceptibility to disease, and by making appropriate interventions in partnership with their patients to prevent illness.
mhm.
So, yeah,
All right.
prevention. Well, I
I
bet
don't,
you could speak to this because you see kids. Isn't that like the best time to try to like
yeah,
treat
I
chronic
see
illness?
kids that are usually not well, right?
Yeah.
So unfortunately, I don't get an opportunity to do prevention as much. Although that is,
But
but
But if they weren't treated properly and they were just suppressed, even
oh,
with this illness, what would their adulthood look like?
tragic,
Yeah,
tragic.
yeah,
Many of them would be institutionalized. I mean, I don't want to even sound dramatic, but like drugs, crime, addiction,
yeah,
institutionalizing, multi polypharmacy for psychiatric medications, never really achieving wellness or understanding what's going on in their body. Like, you're gonna make me cry, Jamie. Like, this is the real thing. Like, when you talk about like really coming in, and like helping to reverse course, this is anyway,
yeah. It's
very important
important.
thing.
I have
Yeah,
nothing but
this is
appreciation for all the pediatric care providers out there, all the pediatricians, everybody doing their best to help the kids. Because yeah, I mean, it's not just like the cliche that kids are our future, but that's a life. And
it's life.
it's so important to figure these things out as early as possible. And it would be even more important to prevent them from ever occurring, of course. And that's kind of what
Absolutely.
the general principle of prevention is that how can we not get to the point where we have to intervene at these high levels and do all this complicated work for these individuals, whether they're kids or adults.
Yeah.
But prevention runs deep, as I just mentioned, because what I know too is intervention with children, especially with neuropsych or neurologic anything, or anything else even. You know, if you can get that figured out, they can course correct. They can course correct. They can have a normal life. They can sort of come back, and so like they'll have that blip, and maybe it'll be a trauma part of their life and all this kind of thing.
Right.
But that can be worked on. The resilience can return, the healing potential can return, the vis medicatrix naturae
Yeah.
uh, can return because it's very high. The force is high in these ones.
Kids are resilient. Kids are really resilient. I mean,
Yes.
and they've gone through some real trauma, but at the end of the day, it's like been given this capacity to be. They're more compassionate. They're more understanding. I've had my own pediatric patients come to me and say, "So I know my friend has this too. I can see it in my friend." Like, and when people like behave badly or dysregulated, like behave badly, right? Yeah,
Yeah.
I look at behavior really differently now. But when kids are dysregulating in public and they can see it and their heart has compassion for them instead of thinking, like ill of this child that's dysregulating in public.
Yeah.
And it's just anyway, it's for
Yeah.
a reason that none of us can even fathom,
Yeah.
that's going through this. And I can only
Yeah,
anyway,
and and we'll
I'll
dive more
ramble on and
into
on.
the no, we'll dive more into this later actually because I think it's incredibly important. I mean, one of the reasons why we got together here too is that it's important to hear you know, uh, childhood medicine, adult medicine, and the whole continuum of this type of care and why it's so important and the
Yeah.
the real stories of these types of difficult situations, even amongst the littlest and the biggest and the oldest and the youngest of us all. So,
Yeah.
but yeah, in an ideal prevention realm, I mean, you're thinking about sort of like a health and wellness kind of thing that like this is where the ideas of maybe if we come together as a society and maybe address some of the issues in, say, like the food that we consume or the chemicals that we put in our environment or something that maybe we're going to prevent or reduce these numbers of chronic illness that we had discussed sort of in our first talk
Yes.
there. And so there's like community health. Prevention runs deep. It's the individual, but it's also the community, it's the society, it's the world. All of this
Yeah.
stuff is incredibly important, and it's really just trying to set you up for the best life that you can have without unneeded diversities, you know, uh, without things that are working against your healing power, as mentioned. That's
Yeah.
really what it all means.
That's a good point. And you worked in a field like you worked in specialized in hormones at one point, correct?
Oh yeah, yeah, I did
Because
that
that's
for a bit.
the ultimate of preventive medicine,
Yeah.
like especially as we age. Like I think that that's really
Oh
powerful.
yeah, I mean the field of proverbial anti-aging, which probably should be more, I think somebody once said graceful aging, uh,
Right. Yeah.
I think is really important, and I think we'll probably have a discussion on that at some point. And hormones are a big piece of it. I do a lot of work with hormones for a lot of reasons, and those are things that
And
change over the course of our lives. And if it was just that one thing, that it was just like, oh, natural hormone fluctuations and changes of life, I feel like. I don't know. Maybe my life would be a lot easier. It's an aspect of it, and then our environment and all these other features, even trauma, stress. I mean, so many different things end up influencing it that the
yeah.
smoothness of that quote unquote natural decline becomes more challenged. And so you do have to take a whole model even for treating those things. But still, if you can catch those pieces early, you can prevent a lot of bad stuff. People do like for my female patients around perimenopausal time is often, you've probably seen the same, as a time where their symptoms can sometimes heighten and become less regulated. So you'll see, and the same thing with kids sometimes too. You'll probably see at puberty and
Yeah.
stuff like that. Hormone fluctuations and shifts contribute. So you catch patterns early. Yeah, I think I liked your one term. Find the soft signs of things too, before they
Yeah.
become a big fire,
Makes
before a
sense.
big disaster.
Yeah.
Uh, it's all prevention at the end of the day. So
All
yeah,
prevention.
all
And you
prevention.
you mentioned this, and I think it's really important to emphasize that I see a lot of chronic illness, like that dysregulated system, come from some really poignant times in our lives, like when we are going through hormonal shifts.
Hmm.
Like that seems to trigger like some of the chronic infections or symptoms more often than not, right? So it's through like puberty, through perimenopause. These are really key times in after having a baby, right? Like
Right,
that. These are
postpartum, that's a
really
big one.
key. Yeah, that's a big one. These are really key times that people come to me, right? Is
Yeah.
usually these transitions in life where their hormones are in flux. So,
Yeah, totally. I mean, so if we can understand that, I mean, I think if you look at the old medicine systems, they were talking a lot about preventing that and trying to find ways, even start. I think that, like, I also have a master's in acupuncture and Chinese herbal medicine, but they talked a lot about different phases of life and sort of longevity is a big part of their tradition too, and
yeah,
how to prevent developing worsening issues at those key phase of life changes and everything. And some of it has to do with like living a balanced life. That's why they have the yin and the yang and all that kind of thing, and not burning out your yang too much. Not burning
right,
out your yin too much either. I'm just like basically preservation. Preserving resources and not pushing yourself too hard. We're in a society of just like push yourself to the absolute max all the time.
right,
The West is different than the Eastern philosophy in that way, just sort of superficially. Not to say that the East hasn't taken the West's ideas in terms of probably industrial revolution and just commercialization and all that kind of thing, but the tradition is that in order for us to live smooth lives in existence, we kind of have this philosophy of balance at any given moment, any given day. The food that we eat, how much we expend energy, how much we're able to sleep, how much we're able to calm, how much we're going to work, how much we're just sitting under a tree, just enjoying the moment.
right.
Um, it's all important. So
I actually had this thought this morning, just stemming from what you just said. Like, what if we all went back to the time when I grew up? Like, what if my kids, my whole family, we just like whoosh, time traveled back to when I grew up? They would probably be so bored. It would be total culture shock. And I remember thinking, it was just this morning. I was laying in bed thinking about this. I don't even know why I was thinking about this. But I was like, how freeing it would be to be like, to wake up and be like, I think I'm going to go play with the neighbors and I'm going to go do a little slip and slide. And I'm going to
Hmm.
ride my bike down to Mandy's house. And,
Oh yeah.
like all these things that I used to do as a kid, like I wouldn't miss a beat. Like if you put me back, like I wouldn't miss a beat. I'd just pick right up and like be loving my life, right? Like
Yeah.
that balance and, and
Hmm.
life is very different now. And I think my kids would be like, what what do you mean you're picking dandelions this afternoon? I was like, I
Right.
was bored. I was bored. What do you do when you're bored?
I
You
know,
know,
and the dynamics do change every generation, to be fair, but still, it's like I think the ability to retain balance in daily
Mm,
life,
yeah,
because of so many external distractions and stimuli and just we'll talk about that sometime too because it is different. It is different. You see that
yeah,
it's different, and you see the responses from these kids too, and just their emotional and social behaviors and just other things. It's like it is different, and so every generation it
it's
is
different.
different, but but we got to try to remember what those things were and what they meant, and
Right.
that's why we have these important conversations. Well, so I think we're gonna have to do a part two on this, Janelle, because
Probably have a part
I
two.
never actually got to the whole therapeutic order of things, and I thought this was going to be a 30-minute discussion, but it turns out
Same.
it's a lot richer than I thought. So what I
Yeah.
really want to do is I think we're going to do a part two very soon because I think we could probably
Yeah.
fill another hour with this material.
Probably. Yeah.
So, any last thoughts though? I think we'll just kind of wrap up for today and then we're just going to pick up right where we left off next time, if that's cool with you.
Yeah, no, I'm excited to pick up where we left off. I
Yeah.
I didn't realize I had things to contribute to this. It's kind of
It,
nice going back over this, and like kind of refreshing it all.
yeah, it's like what Janelle said. I think we just sort of are who we are, and sometimes we don't always remember our roots, like where we came from in complete detail. And sometimes revisiting that in the moment, it actually, yeah, it stimulates a lot of discussion and it brings up a lot of thoughts and it brings up a lot of feelings and it brings up a lot of stuff.
It brings up a lot of stuff. Things that I said I'd never do, and I do them now in practice.
Yeah.
Like I was so rigid, as a student, and
Yeah.
yeah,
Yeah, and I
let
think we want to
go.
talk about more of that too, kind of how we've
Yeah,
grown as practitioners over the years too. I want to talk about that and how we're continuing to grow and how we're continuing to try to better ourselves. So yeah, so join us for part two in the very near future. And
yeah,
honestly, by the time I release these, maybe they'll come out in a few days from each other. So we'll see what happens.
yeah.
Uh, yeah, so thank you for joining us today. I am Dr. Jamie Kunkle. That's Janelle Payne on the other end, and we are Confronting the Complex podcast.
Yes. All right. Thanks,
Have a
Jamie.
good day. Be
Looking
well.
forward to part two.
Thank you.
Take
Bye-bye. Thank you for listening to our podcast, Confronting the Complex with Dr. Janelle Payne and Dr. Jamie Kunkle. As a reminder, the views, thoughts, and opinions expressed by Dr. Jamie Kunkle are solely his own and do not reflect the views, policies, or positions of Gordon Medical Associates or its affiliates. Any content, discussions, or advice shared on this podcast are independent of Gordon Medical Associates and should not be interpreted as a representation of Gordon Medical Associates. Gordon Medical Associates does not endorse or take responsibility for any statements or viewpoints expressed in this podcast. Thank you, and I'll see you next time.